Could you share a few of the kind of top line insights, the top line takeaways from your research?
There will be disruptions in the supply chain, there will be disruptions in the logistics, and there would be also disruption in the normal supportive supervision or the monitoring and training which is being done. So we shouldn't be expecting okay, I will go and train this person on this day on a weekly basis. So we should be prepared for it, and that's why in the very early phase of the pandemic is we should be training uh, people and giving out very clear cut guidelines on what is like what are the essential activities that needs to be done, what are the essential activity not so essential activities which can be postponed, and if they are doing any additional COVID-19 related work, that's something or guidance and training should be provided. And we thought acting against stigma and creating awareness is something which the community health workers were really good at, and that's the role where they can fit in terms of the COVID-19 work. And obviously there's a lot of focus about frontline doctors and nurses who are treating COVID-19 patients directly being provided PPE, but the risk for a community health workers are equally important. So providing the appropriate level of personal protective equipments in the terms of, like, mainly in terms of face masks and providing hand sanitizers and things like that is something that should be done appropriately at that level, and that risk is something which we recommended.
Could you expand upon, like, what are some of the other ways in which you're recommending community healthcare workers' well-being is looked after, and just recommendations for how that can be done so that these frontline workers are protected both from the pandemic and from the community who's so terrified by the pandemic?
The issue here is the well-being of the community, and we want to do that. That's the core work I think we want to do. But how do we do it is something we need to figure out. Okay. And community health workers are a very key to doing this work. That how we can do it is the way through people who are already from the health systems very well integrated into the process. So that's the way to do it, and one cannot happen without the other. I mean think like what says in organizations is like you first need to keep your, not organized businesses, is you first need to keep your employers happy to make your client happy. So if we are not concentrating on the well-being of community health workers, how can we think about the community?
Yeah, that's what's really exciting about when you think about the synthesized learning across the network, is that we're really it's to the benefit of the future, challenges that we'll face like this. We're really kind of doing the research to create the toolkit necessary for rapid response, because our last pandemic was 100 years ago. So like, the world has changed significantly over the last century. But as you said, unfortunately, with the realities of today's world, the next pandemic probably won't be 100 years from now. It'll be much sooner. I only have one more question, and thank you so much, Soumyadeep. You've been fantastic and really generous with your time. But I guess one thing that we would love to, we really want to hear from each of the members is, in thinking about the communities that you've worked with and the challenges that they've faced, and thinking how unique each context is, what is like one main thing that you wish everyone would know about the pandemic's impact on the communities you're working with?
If you ask me what one key line, it is not related to my work, but I think it's that we should be more humble and support each other as a community. And for doing that, we need to build on the social determinants of health and get our basic rights, basic things right. I think we all want disruptive innovation and think, okay, we can do this and change the world. But what we need probably is very basic things like water and sanitation to everyone, and also things like a proper housing. I mean, if we don't have these, No amount of investments in anything can change or impact things in a meaningful manner.